Hello, I'm Ross Schwarzber, a Senior Program Manager for the Engagement Award Program. On behalf of our program, I am pleased to offer a high-level orientation to the Engagement Award Capacity Building Funding Announcement. To begin, here's some key information regarding this issuance of the Engagement Award Capacity Building Funding Announcement, including the deadlines for the LOI and application, the earliest start date for the proposed project, total costs, and the maximum project period. Please follow the link for the full announcement. PCORI funds patient-centered comparative clinical effectiveness research, or CER. CER is research which compares two or more medical treatments, services, or health practices to help patients, caregivers, and others make informed healthcare decisions. Comparing two or more interventions distinguishes CER from other types of clinical research. Patient-centered CER is CER that compares outcomes that matter most to patients and others. It includes the meaningful involvement of patients, caregivers, and the broader healthcare community throughout the entire research process, from planning the study to conducting the study and disseminating study results. The vast majority of the research PCORI funds is for comparative clinical effectiveness research projects. But we also fund awards to promote engagement in research, such as those through the Engagement Award Program. PCORI believes meaningful engagement of patients and others is a critical building block for relevant patient-centered CER. And the Engagement Award Program provides funding to organizations around the country to build a community of patients and others who are equipped to engage in patient-centered CER. Our program not only builds capacity for patients and others to be genuine partners in research, but also supports the dissemination of results back to communities in tailored ways that resonate and speak directly to the community. This program can be a good entry point for some in the broader community who are not familiar with PCORI and our work. Please note that the Engagement Award Program is not a research funding opportunity, and our program does not fund research studies. The Engagement Award Capacity Building Funding Announcement provides an opportunity for organizations and community groups to build capacity and skills for patient-centered CER. Capacity building projects tend to fall into three categories: helping patients, families, caregivers, and individuals within the broader healthcare community who are not researchers to engage as partners in future patient-centered CER, strengthening the skills of researchers to be better partners with patients and other community members involved in patient-centered CER, and supporting prior Engagement Award Program awardees returning as applicants to grow the impact of their work building capacity for patient-centered CER. More information on these types of capacity building projects is available in the full funding announcement. This funding cycle, the Engagement Award Program is offering another funding opportunity similar to the Capacity Building PFA that is exclusively for small organizations. This PFA is called Building Capacity for Small Organizations to Engage in Patient-Centered CER. We created this funding opportunity in 2022 in recognition of the unique perspective small organizations can bring to the patient-centered CER process. One key feature of this PFA is the learning network that all awardees funded under this PFA will participate in. If you meet the eligibility requirements shown on this slide, we encourage you to read and consider applying to the Building Capacity for Small Organizations to Engage in Patient-Centered CER PFA instead of the Open Eligibility Capacity Building PFA. An applicant town hall will occur for this PFA on August 11th and will be recorded for later viewing. We recognize CER is more useful and relevant when patients and other partners are involved throughout the full research lifecycle. PCORI encourages early and continued engagement of patients, caregivers, communities, and other partners in CER. To help refine the engagement activities of research teams, PCORI developed the foundational expectations for partnerships and research, which provide the building blocks for meaningful engagement and help guide applicants in developing engagement plans for CER. These expectations aren't rigid rules. They're guidelines that adapt to your project's specific goals and team members' needs. For instance, when you plan for early partner engagement, you'll naturally develop practices that strengthen team collaboration. The foundational expectations help project teams in the following ways: maximizing partner contributions throughout all project phases to achieve goals and outcomes, facilitating engagement discussions and planning for patient-centered CER, proactively identifying and addressing potential challenges, and utilizing and enhancing team member strengths and assets. Engagement Award Program funding announcements require all applicants to address PCORI's foundational expectations for partnerships in research. Project teams are expected to address the foundational expectations when applying for PCORI funding, when developing project and engagement plans for awarded projects, and when reflecting on engagement during a project to improve and strengthen engagement over time. There is flexibility in how applicants address the foundational expectations. Details on each of the foundational expectations, along with FAQs, additional guidance, and other resources, are available on PCORI's website. A direct link can be found in the funding announcement you are applying to. PCORI evaluates engagement award applications based on these 6 review criteria. Our reviewers seek to determine whether the application demonstrates program fit and an innovative idea that supports the organization's mission and adds to the Engagement Award funded project's portfolio. Another important criterion is whether the project plan and timeline seem reasonable. Reviewers also assess whether the qualifications of the project lead align with the scope of the project, whether there are adequate and qualified personnel to conduct the project, and whether the overall project team demonstrates sufficient past performance for related projects. Additionally, reviewers will determine if there is adequate engagement of stakeholders through meaningful and appropriate collaborations based on the interest, expertise, and scope of the project, and reviewers will also closely analyze the budget to determine whether it demonstrates reasonable costs. We have a few tips to familiarize first-time applicants with the Engagement Award Program funding mechanism. The first tip is to download and read the PCORI funding announcement very closely. The PFA describes the objectives and requirements of the specific funding opportunity, the types of projects we cannot fund, and important guidance for submitting a successful application. The next key resources for applicants are our LOI Readiness Guide and Application Readiness Checklist. These documents are unique to the PFA you are applying to and linked within the PFA. They should be utilized by all applicants to orient you to the LOI and application submission process in PCORI Connect and the types of questions and materials you will be asked to submit. The next tip is to make sure your project is fully responsive. The work that we fund under the Engagement Award Program is unique, and not every project idea will be responsive. For example, we cannot fund projects that are research studies, projects that do not have a clear focus on patient-centered CER, projects solely intended to increase patient engagement in healthcare rather than healthcare research, or projects to design or test healthcare interventions. You can see the full list of non-responsive categories within the PFA. As a point of emphasis, the next tip is to really make sure that your project has a clear focus on patient-centered CER. We are laser-focused on patient-centered comparative clinical effectiveness research, not healthcare research in general. And finally, be sure to demonstrate meaningful engagement of patients and others throughout your project. Like you, we are interested in authentic engagement of patients, caregivers, and the broader healthcare community, not just checking a box. In LOIs and applications, we'd like to see how patients and others have been involved in the project design and how they will be meaningfully involved throughout the duration of the project. All projects must address PCORI's foundational expectations for partnerships in research. Thank you for taking the time to learn about this Engagement Award Program funding opportunity. If you need to get in contact with the Engagement Award team, you can reach us by emailing ea@pcori.org. You can also visit the Engagement Award Program website using the link on this slide, which will have information on our funding announcements and links to information about previously funded Engagement Award projects.